Okay, so what in the world is going on with COVID? The U.S. is in the middle of a significant wave of it right now, according to the CDC. To tell us what those numbers look like in our area, we want to bring in Dr. Peter Hotez, infectious disease expert at Baylor College of Medicine. Good to see you, Dr. Hotez. Thanks for taking time to talk to us this morning.
Good morning, Melissa.
Well, it looks like the CDC has really been watching wastewater lately to find out those levels, and it's showing to be the highest since summer of 2022. Is that the case here as well?
Yeah, it looks that way. We're not following COVID hospitalizations anymore. There's a big push now to get those numbers back in play and starting in October. But for now, we have to rely pretty heavily on wastewater, which has been a reasonably reliable indicator. And here in Houston, with the county, the city health department, and Baylor and Rice, we've been doing monitoring wastewater testing pretty closely, and it's really high right now. And it's been at a very high level for the last 5 weeks. So what happened was we reached our lowest point ever during the pandemic at the end of April, beginning of May, and we were all kind of high-fiving ourselves, saying, hey, maybe this could be a last gasp. But unfortunately, it's really accelerated, and now it's been very high for the last 5 weeks. So we keep on hoping it's going to come down soon. But right now, there's still a lot of COVID transmission going on.
Well, since we aren't watching those hospitalization numbers, if it's actually COVID, is there any way to say how people are handling it? Is it still that just sort of a miserable cold symptoms going on, or people with a lower immune system still being hospitalized, do you feel like?
Well, it very much depends on your vaccination status. If you've been getting your regular annual immunizations, including the last one last fall, and for some a booster with the XBB immunization, your risk of being hospitalized is greatly diminished. But there's some people who have still never gotten vaccinated or have not been keeping up, and they are at some risk of hospitalization. So the bottom line is keep up with your immunizations. And here's an important point now. Hopefully by the end of this week, possibly early next week, the FDA will approve the next immunization, the next annual immunization against the currently circulating variants, which we call the FLIRT variants, F-L-I-R-T. It stands for some amino acid substitutions. And so hopefully that new vaccine will become available, and that's what you want to get. And that's probably the single most impactful thing you can do to prevent yourself from getting a repeat episode of COVID or possibly even hospitalization.
Besides that, what else do you suggest? Are we just going back to that good old-fashioned hand washing that we all learned 20 seconds is the key to that years ago?
Well, let me give you an example. I have to fly to Washington, D.C. tomorrow, and, at the end of April, beginning of May, when the level was so low, I felt comfortable going into Bush Airport and on the plane, even without an N95 or KN95 mask. But guess what? It's back on now, and so that's really important when you're in big, crowded areas with lots of unvaccinated people. You want to have that mask, especially if you have underlying risk factors.
All right, Dr. Hotez, thanks for taking time to talk to us this morning. Baylor College of Medicine, Texas Children's Hospital. Appreciate your expertise.